Go ahead.
Myth or fact? Starting insulin means I'm a failure at managing my diabetes.
Completely false. Insulin is probably the best medication available to control your blood sugars.
4 more. 3 more.
There's nothing better than exercise and control weight management with diet, because those target more than just blood sugar levels. They target your level of fitness, your cardiovascular risk. But as far as medications and oral therapies to control diabetes, insulin by far is a superior drug.
Myth or fact? Insulin causes weight gain.
That's a myth. When you start insulin therapy, you become more efficient at using your calories, and so you tend to gain weight. But it's not the insulin. To say it differently, the cells of the body are starved. And so that individual senses hunger and they eat constantly. Once you started on insulin and you start utilizing those calories better or more efficiently, you have to really change what your dieting is or how many calories you've been taking in so that you're not taking too many calories for the activity level that you have.
Myth or fact? Once I start insulin, it's forever.
True and false. Anyone who has type 1 diabetes will require insulin for the rest of their life. Anyone who has type 2 diabetes has various treatment options, including oral agents and insulin therapy or other injectable therapies. That individual certainly is capable of better exercise, better dieting, and certainly has the ability to come off of insulin. It is not lifelong.
Myth or fact? Now that I'm on insulin, I can eat whatever I want.
Should you use that insulin pump or insulin therapy as an excuse to overeat? Absolutely not. You gain weight. You have abnormal cholesterol. You put yourself at risk for heart disease. You put yourself at risk for hypertension. All of those in combination with diabetes is really quite dangerous.
Why don't you pick out something that you like to eat at home, and we'll talk about the label and how much it would cost you.
It's always a good idea to have as part of your diabetic team a nutritionist or a diabetic educator who can help you kind of navigate it.
The 100% whole wheat bread.
It's very difficult to manage your diabetes without knowledge of what it is that you're putting in.
90 milligrams out of your 2,000.
So I think that that's a critical part of good management of diabetes.
For 1 cup serving. Mm-hmm.